Hello, everybody, and welcome back to No Bones About It, a Columbia Orthopaedic Group podcast. My name is Bo Bayman, and I'm glad to be joined today by MRI manager Ryan Norris. Ryan, good to see you. Thanks for being here.
Thanks for having me.
Let's talk MRI. What is the latest and greatest going on downstairs here at COG?
So at COG, our imaging center is called Columbia Imaging Center. We're part of the COG family. We have two MRIs downstairs. We have a 1.5, what they call a short bore. So those people who are claustrophobic, that's the more confined one of the two. And then we also have a 1.2 Tesla open MRI. On that one, the sides are wide open, so there's no constraints there. You still have something over the top of you, but for people who are claustrophobic, the open is a better option for most, and also gives you the same or close to image quality because it's still a 1.2 Tesla magnet.
And the good thing is you can request the open, right? Because
Correct.
there are a lot of people who are like, hey, I can't go in that too.
Yeah. We, if you work in MRI, you see that a lot. There's a lot of claustrophobic people out there. So we get a lot of people that request. If you see a physician here at Columbia Orthopaedic Group, just request the open MRI see if that's an option for you. So whatever body part that we're scanning has to be in what's called the ISO center of the magnet. So like if we're scanning your feet or your ankles, knees, most likely your head's not going to be in there. But for lumbars, spines, cervical spine, your neck, you will be underneath or in the magnet for that.
It's a little cozy in there. I've been in there. Now, I'm not a small dude, but I've been in there. It's a little cozy when you have to have your spine looked at.
Correct. And probably in what they call the short bore, probably the shoulder's the worst one for average fella like yourself.
Yeah, I believe that. But there's a lot of things that happen downstairs. I mean, besides just MRI, I mean, you got tons of stuff going on.
So we also have a CT scanner downstairs. So we do a lot of fracture or planning for surgeries. We also can do what's called myelograms. So if for some reason you have some type of implant or something that keeps you from getting an MRI, we can also do what's called a myelogram. And then we do a lot of pain injections. All that is ordered by your physician that you'll see here. And then usually we can get you in within a day or so and get you hopefully on the road to recovery.
And really, it's not too long of a wait either. I mean, you check in downstairs and you might have a couple of minutes, but you're usually, if you're at 9:30, you're probably on the board at 9:30.
We try to be. That's a service that we try to spotlight downstairs is that if you're getting an MRI, you have one MRI questionnaire you have to fill out just to make sure that you're safe to go into the MRI machine. That is also offered online, so you could do that ahead of time, and we just have to print it out. And then once we get that sheet to make sure you're physically safe to go into the MRI machine, we're usually most of the time, we're very much on time, if not ahead.
How'd you get into this?
Good question.
Did you go to school for this?
Correct. So I graduated from SIU Carbondale, 96, and they offered a
1990, not 18.
Correct.
Yeah,
Correct.
okay. Just making sure.
I may look 97. So back then, they just offered a diagnostic X-ray program. So I became an X-ray tech, and then through the years, I learned CAT scan, and then you take a registry. Then I learned MRI, then you take a registry, and through the years, I've been here at COG since '08. I've worked I've worked all over the country, really. I worked down in Arizona. I've worked in Kentucky. I've worked in here in Columbia a couple times. Worked in St. Louis. I think that's most of the places.
Were you, if you've been with COG since '08, were you in the old building or
No, I started
with the new building?
right when they came to this building.
Okay,
Yeah.
okay. Now, there's a ton that people don't know that I didn't know. Like, you have to do recalibrating. You have to get a whole bunch of, service calls and make sure you pass
Correct.
tests. I mean, there's a whole bunch of certifications you have to get.
Correct. So our two MRI machines are accredited by the American College of Radiology, which is called the ACR. So every 3 years, you go through this extensive process. Yeah, we have to submit images to the ACR. They go over our images, protocols. We have to have a bunch of paperwork on the back end. And then every 3 years you go through that. But then we also have maintenance contracts with Hitachi. Our scanners they used to be Hitachi, now they're Fuji. But we have a maintenance guy who comes in once a quarter, does all the
Routine stuff?
routine maintenance, QA. We also have weekly QA we have to do to stay in line with everything. So yeah, they're highly regulated machines, and also the CT has to be accredited. It's also in an outpatient facility like we are, you have to be accredited in order to get reimbursed by the insurance. So the government's getting you on both ends.
The accreditation process isn't easy, is it?
No, it's a
It's a process.
multi-month process of just checking all the boxes, and then not every patient is able to lay perfectly still or do everything. So we have to kind of pick and choose our patients and all that. But it's a 6-month process probably from when I get the email that I need to start the reaccreditation process to before we're passed, or even before I get to meet all the criteria to submit my stuff. So it's a lengthy process, correct?
Um, let's talk about, there are some people that move, and if you're in there for, a half an hour, you got to adjust. And
Yeah.
usually there's a break where you say, hey, if you got to move, you
Yeah.
feel all right. But the difference is if you move, the images aren't as clear, right?
Correct. So it's just like any camera. If you move or jump or whatever you do while somebody's trying to take your picture, the picture's going to come out blurry. So it's easy to tell when the MRI machine is on because it's making the loud noises, similar to a jackhammer, whatever you want to call it, construction zone. So in every instance, the machine will come on. The first few sets of pictures are what's called localization. So we're just finding the body part that we're trying to scan. And then after we find that body part, then those sets of images, anywhere from 3 to 5 minutes apiece, and it'll make the noise constantly for that 3 to 5 minutes. And then it'll go quiet for about 10 to 15 seconds, and it's setting up for the next set of pictures. So when it goes quiet, that's a good time to cough, clear your throat. If you got an itch, that's a good time to do it. You'll also have a call button that if you feel a cough coming on, or if you're in pain or you don't want to continue, you can push the call button and we're there instantly to get you out.
Yeah, there are precautions in place, if you will. I mean, a lot of times you're listening to music in there, just trying to relax. I mean, that's the best part, isn't it?
Yeah, we do not have music. We just give you headphones or earplugs, depending on what type of MR you're getting. But yeah, we've done this for years, so all kinds people will work on their to-do list, or if it gets close to the holidays, people are thinking about their Christmas list or whatever that is. So you have to just kind of go to your own spot in your mind and just kind of relax. For almost every MRI we do is somewhere between 22 to 28 minutes if we can get through the first time without having to repeat anything. So, and it varies. Some people, when we bring them out, say, well, that didn't seem like 20 minutes.
Sure.
Some people will come in and say,
It was 2 hours.
That was an hour, So, when you deal with the public, you get all kinds of stuff. That's just the way it is. So, we try to do our best when we put you in there. We'll try to put pads, blankets, whatever you need to try to get you comfortable at the start, so that you can hang in there for the 20 minutes. Because one, it costs a lot of money to get an MRI, so we want to give you the best quality and do the best that we can for you. So some people get mad at us because we're telling them that they're moving, and so I'm not moving, but we're looking at the images, so we know that they're not perfect. So we're just trying to do the best. We're not trying to be mean to anybody or any of that stuff. We're just trying to get you the best for what you're paying for.
And here at COG, really, it's kind of neck down, right?
Correct.
You can do anything.
Yeah, so orthopedic-wise, so you think anything bones, anything joints, we do a lot of MRIs of your spine. And then, so probably our lumbar spines, which is your lower back, your knees, and your shoulders are probably the three most MRIs that we do here at COG.
We obviously do X-rays here at COG. To the layperson, what's the difference between the physician looking at your images with the MRI and the X-ray?
So an X-ray is just a one-dimensional, either what's called an AP, which is a front view, and then a side view. So So it's just a generalized picture of the thing. So then an MRI or a CAT scan, we take cross-sectional images, so we can take them in different planes. We can take them in what's called coronal images, which is from front to back, sagittals from side to side, and then an axial image is like we're slicing you like a loaf of bread. So in layman terms, an X-ray is a Ford Festiva and a MRI is a Lamborghini. So you're just getting so much more information. You're getting you see MRIs, you really just are. Pardon me. X-rays, you just see the bone and and very limited soft tissue. Where in MRI, you see the bones, the soft tissue, the ligaments, all the tendons, everything. So it's just much more information.
And there's a whole bunch of images there that the physician can scroll through and say, if you're looking for a torn ACL, if you're looking for a torn labrum, whatever, a herniated disc, anything like that, it's a lot easier to see on an MRI.
Correct. You can't see a torn ACL on an X-ray. Sometimes with a torn ACL, your bones are out of place, and then that leads them, along with the physical exam, they have a good idea your ACL's torn before you get the MRI. But so say for an MRI of your knee, we take 7 different sets of pictures of your knee. 3 from the front, or two slicing you like a loaf of bread, 3 from side to side, and 2 from front to back. So basically each one of those 7 sets of pictures show you something different. So an MRI is kind of like a puzzle, which then we send the images to the radiologist, who's a board-certified physician that specialized in radiology. Just like the doctors here specialized in orthopedics, they specialized in radiology. So then they read and interpret the MRI, and then a report will go to the our COG physician, and then they'll look at the images, see what they think. They'll look at the report from the radiologist, and then make a determination on what the next step should be. So at least if you have an MRI here, at least 2 or 3 doctors have looked at those images and formed an opinion before something's going on.
Do you have to have a referral to get an MRI?
Correct. MRIs, CAT scans are just like pharmacy drugs or anything. You have to see a physician first. We offer the same day clinic now where you can walk in, and then that kind of gets you out of the kitchen, kind of circumvents the system a little bit, where it gets you in quicker. And then they can order MRIs through the Ouch clinic. It can be same day, but a lot of MRIs have to be pre-certified by the insurance companies.
Yep.
So in order to get pre-certified, then you have to submit your doctor's notes of the visit. So depending on what type of insurance you have and what the pre-certification process is, some of it's in a day or 2, some of it's got to be more than 5 days. Some insurance companies make you go through 6 weeks of physical therapy before they approve an MRI. So unfortunately, insurance companies control a lot of how fast you can get the MRI.
Yeah, they sort of dictate that. And I was going to mention that because a lot of people are like, well, I'm already here. Why can't I get it today? And that seriously is why.
Correct. There are certain insurance. There's the state insurance program that used to not require pre-cert. Most types of Medicare do not require pre-cert. So it's just all based on what type of insurance you have.
And then what type of openings you all have. Because, I mean, it's 6 to 6 pretty much, Monday through Friday?
Correct. We do, yes, from 6. Our first appointment's at 6 a.m. Our last appointment's at 6:10 p.m. So we're usually here from 5:45 a.m. to 7 p.m. And then there's a few minor changes through the week, but we try to get it done.
Yeah, and it's pretty slammed too. I mean, I've seen the schedule. I mean, it's hard to fit somebody in unless there's a cancellation.
And most cancellations, since they've usually had to wait because of insurance or something to get in, there's very few cancellations because they decide.
Only denial, right?
Denials, yeah. Or then there are the occasional people that we try to put in the machine and they say, no, thank you.
I totally understand that.
They're not hurting quite so bad once they get in there. And then we offer, it comes through your providing physicians, but then they'll give you some little medication to help you relax. And most of the time, with a couple pills, you can make it through the 20, 25 minutes. For those people that are extremely claustrophobic, then we'll send to Boone Hospital where they can get conscious sedation, where they'll put you out so you don't even know you're in there.
Yeah. Another thing that I didn't know before working here was how heavy these things are. Because if you have to move one, like when I don't know, about what, 8, 9 years ago, got a new machine.
Is 18, so you have 7 years.
Yeah, 7 years ago we get a new machine, and boy, that was a process to get it in.
Correct. So, the MRI machines itself is very expensive, but in our instance, we have to do a lot of remodeling, tear a bunch of walls out. So the magnets come in one piece. So they're about, say, just imagine a 10 by 8 box or something, and that there's no give to it. So you have to tear out an opening that big. And then it came in, they put it on wheels, and some guy, it was like a remote control car. He had a little thing around his neck and just drove it right into the building. It was pretty neat to see, but it's not changing MRIs or buying new MRIs is not an easy process in most cases, because there's a lot of the MRI itself is expensive, but then when you add the construction costs, they get real expensive.
The construction costs plus the moving costs plus
the downtime.
The downtime. Yeah. It's something. Anything else we need to know about downstairs? Let me ask this. You got a great team down there.
Correct.
A lot of people who have worked here a long time. So familiar faces for sure if you've been here a couple of times.
Correct. So there's 7 of us techs downstairs. There's 5 of us that have been here over 15 years. There's a couple that's right around 10. And then we just got a new tech that's just been here less than a year. But most of the faces downstairs in MRI, our Kelly is our most senior employee. She's been here 34 years.
Wow.
In some aspect with COG. So I think we have a 34, a 24, a 22. I'm 17, and then Sarah's 12. So we have a very experienced staff that have been doing this for a while. So hopefully we know what we're doing most of the time.
And you're doing a good job down there to keep them around, and they do a great job for sure. I mean, you come in, you check in, and in most cases, under an hour, you're out the door.
Correct. That would be on the long end, depending on what test you have. Sometimes we do multiple tests, but unless you show up way early before your appointment time, probably 5-10 minutes before your appointment time, we'd be ready for you, or maybe 5-10 minutes after your appointment time. Our appointment stack are pretty close together, but we have plenty of time. And then if really the only time we get behind is if a patient is having severe problems.
Sure. And
just from a pain or holding still standpoint.
Yes. Stop and start over.
If patients cooperate, we're usually right on time.
Yeah, no doubt about it. Hey, Ryan, thanks for the time.
Thank you, sir.
Ryan Norris, everybody, of Columbia Orthopaedic Group's MRI department. Thanks for watching our podcast, and listening to our podcast, No Bones About It.